Dr. Jonathan Javitt is the founder and CEO of NRx Pharmaceuticals, a company that's working on pioneering treatments for PTSD and suicidal depression. Dr. Javitt, welcome, and I understand you, as soon as you're done here, you're going to Las Vegas, to Nellis Air Force Base.
Well, we've started working with Angel Force USA, an organization that's committed to stopping what they call suicidality. Because even though we lose 22 veterans in active duty every day, even though suicide is the second leading cause of death in that age group, there's not enough talk about it. People are not getting the help that they need. And what's amazing is that all of a sudden we have treatments that really work.
Okay, so you're going to be meeting with them?
I'm actually going to be briefing in front of 5,000 officers, troops.
Okay, and just like start the conversation.
Starting the conversation.
Or at least elevate it. So, also some progress on ketamine. So you just got notification from the FDA that your preservative-free ketamine filing was accepted and has a July PDUFA date. Am I saying that right?
You did say that right.
Okay, yeah. What is that? Why is that important? What does that mean?
Well, first of all, it's going to be the first new ketamine formulation made in the United States in a long time. But more importantly, ketamine, developed back in 1970, has always had a toxic preservative in it, benzethonium chloride. Toxic to the point where it's not generally recognized as safe by the FDA. It's generated concern within the FDA to the point where they don't even allow that preservative to be used in hand cleansers and topical antiseptics. So the notion of putting it into an intravenous drug is just crazy. I mean, it would never be allowed today. So we've shown that you don't need the preservative, that the drug is safe and sterile and stable for years at a time in a modern glow-fill seal vial. And we've petitioned the FDA to not only let this drug on the market, but to take the preservative-containing drugs off the market.
Okay. And then also you've announced the acquisition of your first Hope Clinic with initial revenue. So explain that. What is the Hope Clinic? How does this business model work?
So we started out as a fairly conventional biotechnology company developing drugs for suicidal depression and PTSD. And what we've realized over the last couple of years is that drugs will never be sufficient. But if you're able to combine neuroplastic drugs with other neuroplastic treatments, specifically transcranial magnetic stimulation, hyperbaric oxygen, new things that are coming down the pike, digital therapeutics, you can really create magic. Just a couple of weeks ago, there was a publication showing an 87% response rate from a single day of treatment in patients with severe depression. Now compare that to the 30% response rate that the large trials have shown you get with antidepressant pills, and you realize that this is a whole new world. When I use that word neuroplastic, it's the kind of word that makes people want to tune out, big word. But what it means is the process by which the brain cells make new connections, new synapses to other brain cells. So when you talk about a digital computer, you've got millions of transistors that turn on and off, and that's what software is all about. The brain doesn't work that way. The brain works by continually forming new connections between one cell and another, pruning those connections. That's how thoughts are stored, that's how memories are stored, that's where emotions come from. That's where the flashbacks and PTSD come from. And when that process of neuroplasticity stops, really bad stuff happens. If it happens on the left side of the prefrontal cortex, you get depression. You've got loss of neuroplasticity in the right prefrontal cortex. That's where we believe the anxiety, the flashbacks associated with PTSD come from.
Okay,
Other parts of the brain may control autism, control traumatic brain injury. And if you can restore neuroplasticity in a precision manner, you can have drastic and rapid effects on diseases that have mystified us for thousands of years.
Fascinating. Okay, and then also recent studies show that your drug, Cycloserine,
Yes.
am I saying that right? The ingredient in NRx 101 may increase the effectiveness of TMS. So you just explained TMS, or at least defined it. What is that exactly, and what how important is that to your research?
Well, so TMS is a treatment that's been around pretty much since 2010, where you use very powerful magnetic fields to stimulate the brain to start growing new connections, to restore neuroplasticity. And this is really a finding that caught us by surprise. We developed cycloserine at high doses because it's a potent antidepressant. But it turns out that at low doses, it really transforms the effectiveness of TMS. So until just a little while ago, people said TMS works about 50% of the time in achieving a result from depression. And then initially a scientist named McGeer in Calgary, British Columbia, took work that was originally pioneered by Josh Brown, who's chairman at Harvard McLean, showing that cycloserine, which is an NMDA agonist, it's a neuroplastic drug in the brain. It's like fertilizing the field before you plant the seeds. When you treat with cycloserine before you do TMS, you more than double the effectiveness.
Wow.
In terms of just getting any kind of response. And in terms of achieving real remission from depression, it's like an 8-fold benefit. And you can see this in a published peer-reviewed paper. There are about 5 or 6 of them in the literature now. The effect is as dramatic as anything I've ever seen in medicine.
Wow. Fascinating and important research. I mean, all things, as you mentioned, I mean, these are things people have been struggling with for thousands of years. So sounds like there's perhaps some breakthroughs.
Important in research, but
sure.
as a pharma company that's got this drug in the warehouse and has an IND filed, it's incredibly important for us from a commercial perspective.
Do you have a timeline for that? When you think, like, what's next?
So we're talking to several government agencies, not only the FDA, but actually government agencies that are actively interested in funding this kind of research.
Okay.
And we expect we've already filed the protocol. We don't need a new IND because that's been on file with the FDA for cycloserine since 2017. We've already got breakthrough therapy designation for that drug. But we filed a new protocol specifically to prove what's already been shown in phase 2 studies, that cycloserine has a significant and beneficial effect on the ability of TMS to achieve remission from severe depression, from suicidality, from PTSD. And if we're successful, it changes the world.
Yeah, well, and please keep us up to date on that because very important work that you're doing. So, Dr. Javitt, thank you so much.
Thank you.
Thanks.